Okay. Hello, my name is Everett Browning, and I'm a prostate cancer survivor. Back in 2008, I was diagnosed with prostate cancer. I had my prostate removed through surgery at Riverside. But my story that I like to share on this family chat is that my story did not end there. I have two brothers, and my media attention turned to them because because our father had prostate cancer, that put all three of us in the high risk for getting prostate cancer. So my immediate concern after I got my prostate cancer attended to was to urge my brothers to start monitoring their PSA levels and to also discuss their situation with a urologist in addition to their primary care physician, because I felt very sure that it was coming their way because our father had it and I had already tested positive for prostate cancer. And as it would happen, even though my two brothers are older than I am, I was the first one to get it. And about 2.5 to 3.5 years after I was diagnosed with prostate cancer, each one of them were diagnosed with prostate cancer. And I'm happy to say they both were successfully treated for it because they were aware, they were monitoring their PSA levels. And when things started going, numbers started going up, they both went on to see a urologist for treatment. But it doesn't end there. I have a son. I have grandsons. So the next part of the family chat for me is that I made my son, who's now in his late 40s, aware of the fact that I had prostate cancer and that puts him in the high risk, and that he needed to share that with his primary care physician so that they could start monitoring his PSA level no later than him turning 40. I believe he started around 35, 36, monitoring his PSA levels. I'm happy to say there's been no movement. His numbers are low, so I'm real status for that. I also had this same conversation with my nephews, my brother's boys, because I wanted them to be aware. And it seems like every time we have a family get together, and for the past year, it's been Zoom just like this meeting. I always bring it up as all the men that's on the phone that's over 40 to start monitoring your PSA levels. So it's now become something that my family expect me to say when I see my nephews and my son. I ask them about it. And I've also talked to my son, you need to let my grandsons know that they have a pending health issue as they get older in life so that they are aware and educated on it and that they need to be on the lookout for it because it's in our family history right now. So I urge everyone to know your family history. It is so critical to staying ahead of prostate cancer. I think back in the 40s or 50s or whenever, growing up in the 60s, we didn't talk a lot about family history. But family history is very, very critical into knowing your status with prostate cancer.
All from Prostate.
Well, thank you for your time, and I appreciate you listening on. And now we'll pass this on to Mr. Justin Baker.
Thank you, Everett, for talking. And it just brings to mind so many different things. I'm just beginning my journey, and I had always been aware of the indicators of prostate cancer, and they are age, ethnicity, that family history, genetics, and obesity for some strange reason. I have been monitoring my PSAs throughout my uh, career in the military. And then after the military, in my second life as a university professor, I continued to monitor it. Even after leaving Virginia and coming to Texas, I continue to monitor my PSA, and uh, I'm suffering from arthritis, rheumatoid arthritis, and my doctor, my rheumatologist, picked up on a rise in my PSA. So immediately going back to my primary care, we check and we try to work on different things. Finally saw a urologist, but with all of that, of course, the urologist wanted to do a biopsy. I had to talk to people I trusted, like Charlie Hill, before I would consent to doing a biopsy. So I'm at a very early stage. I was diagnosed in February of this year. I had the MRI done, and I'm at a very low stage of prostate cancer now. And so what I'm doing is, as Charlie Hill recommended, I'm charting my PSA levels and watching them. I'm doing what we call uh, watching very closely. I'm checking my PSA every 3 months, charting it. I go back to see the urologist in December. This last PSA check, it went up again. So I'm concerned about that. But what I want to do is talk to you about education. Uh, we have all been aware of this, and I have to contradict Charlie. He says there's nothing new with prostate cancer, but there's so many brand new trials out there. The VA is running them, different hospitals, and they have a focus on African Americans, Black males. One of 6 Black males will uh, be diagnosed with prostate cancer. One of 6. That's a large number. And just like Everett, the first thing I did after my diagnosis was to notify every male in my family, uh, whether we are biologically linked or not. I wanted all of them to start checking their PSA levels. Everybody does the colonoscopy because it's recommended, but many times we don't educate ourselves enough about PSA levels. So I'm at the beginning, just starting this journey. And so I'm here to listen to others who have gone through the journey. I won't make up my mind about different options until after my second MRI so that I can see if it's spread, if it's aggressive or not. And so I'm listening. I want to hear more, and I'm here to listen to each of you. Thank you very much.
Thank you, Mr. Spencer Baker. Your story is an exciting one to many of us, certainly for me. And we hope that in the course of this conversation that you will get something that's helpful going forward. 2 things are going on now. Mr. Pickney, Mr. Holmes, Reggie, Mr. Pickney is saying he's getting, host will let you in soon. So he's gotten that close, and I'm asking you if you would see if you can assist in that matter. Meanwhile, I would like for Larry, Mr. Pegram, to talk about his story, because each one of us has a different story. And I think it would be helpful for all of us to have our stories on the table. And I'm delighted to see one of my high school classmates from Chesapeake on the call as well. So welcome, Johnny. Larry? Did Larry leave us?
No, I'm here. I got you.
Okay, talk about yours, please.
Okay, I guess I'm probably the old timer down there as far as the prostate, but I was diagnosed around 2020, around about that time. And once I got diagnosed, and the way I got diagnosed is that I went to a forum with Charlie Hill, and he had the doctors and the nurses there, And I said, well, let me go ahead and get checked out in this. So I said, so when I got checked out, the lady said, well, Mr. Peckham your PSA was a little high. She said, you need to check out your oncologist and see what's going on. So I went to the oncologist and he checked me out and said, well, okay, Mr. Peckham. She said, yeah, your PSA is a little high, so we need to check on that. So the next step was just go ahead on and get things checked out. And after that, after I got checked out and diagnosed that I had prostate, the next step was to go ahead on and start doing testing. So when I went to the urologist, he gave me I did the test where you do 12 tests, and 12 of those tests, 8 of them were positive out of the 12. 8. So he told me, said, Mr. Peckham, said, you don't have to do nothing right now, but she said, but your PSA is kind of high. She said, it's up to you now. So I had my wife with, and that's a good thing too. I always had my wife with me. She was right there from day one, what I was doing. So she knew exactly what I was doing, and she kept me on the track. Because I said, man, I probably about to fall out of my shoes, man, when I found out I had prostate cancer. So she said, well, we're going to work this out together, Larry. No problem. So she did the legwork for me. We went this place and that place. Like I said, when they did the testing on me to do my biopsy, out of the 12, 8 of them were positive. 8 of them. And about 5 of them were like 8 and 10s. 8 and 10s. So it was really progressing in me, but nobody said nothing. So I said, well, I had no symptoms. I had no feelings. I had no dizziness. I had nothing. I wasn't, and the weight I am now, and that's what the weight I was earlier. So, but with all this knowledge out here and talking to all the urologists and talking to this person, but the main person that I want to talk to you about was Charlie, because I sat down with Charlie and we talked this whole thing over. My wife was right beside my side, and he said, Larry, he said, I had the same thing. So he said, what you want to do? So I said, well, at that option, we didn't know anything about proton therapy. It was brand new. So nobody wanted to say anything about that. But you know what? I went over there and talked to the people myself. I said, and I asked them, I said, will my insurance pay for the surgery if I went to proton therapy? And they said, yeah. I checked all that. And see, my wife did all the checking for all my insurances to make sure if I went to this place, my insurance would pay for it. My insurance paid for everything that I did. I didn't have to pay out a dime. My insurance paid it out. So use your insurance, but make sure you do all your legwork, because it might not be covered. Something might be covered, but all my tests were covered, all my hospital things. But the main thing, I had an option. I could go to regular surgery. I could do radiation. I could do chemo. I had 3 or 4 options. But I decided to go ahead on and do just have the prostate removed. So I removed my prostate. And after that, well, my PSA dropped on down to almost 0. But 3 years later, my PSA started going up. And I said, wait a minute, how can my PSA go up when I don't have a prostate? So I went to talk to the doctor before I did anything. And he said, Mr. Peckham, he said, when they did the surgery, they might have missed something, something might have been hiding down in the prostate area. So then after about a couple of years, it flared up. So I had to go back and do radiation. So I did radiation. I did 7 weeks of radiation, 5 days a week. And After that, my PSA went down to to nothing almost. So I didn't have any more problems with my PSA. And at this point now, I just did my PSA test about a month or 2 months ago, and it was untraceable. So they showed that you have to check behind yourself, because sometimes things do happen, which it happened for me, but I had a good team of doctors and nurses and to let me know what's going on. And hey, I'm feeling pretty good right now. I just got to go ahead and keep some of this weight off me a little bit. But other than that, I have no problems. So, but like I said, to today, I'm very cautious of what I eat and when I eat and all that. So my thing is, and make sure you exercise a little bit. Now I'm like this. I don't exercise that much, but I need to exercise more. I need to walk some more and do more walking, because everybody that I've talked to said, Mr. Peggin, that's the best remedy for anything, walking. So you guys need to walk. I need to walk. So we need to walk together, or we need to walk individually. So that's my thing. I'm finished, Mr. Charlie.
Thank you, sir. I'm always amazed at how well you provide that story, because you're so consistent. And I think it's important that we all hear each other. And the themes that I'm hearing include the importance of a spouse or someone that you can confide in and who's going to be with you when you start talking with the doctors. Another theme is how important family history is, and the linkage between fathers and sons and grandsons, etc. There is that idea of understanding and the complexity of this whole process, and I refer to it as the prostate cancer experience. I will say, Mr. Pickney may be popping on at any minute, and we'll let him tell his story, because it's a fascinating story as well. But Mr. Pickney, are you on, sir? Not yet. Okay. What I will do at this point is encourage all of you to ask questions of each other, and we'll still try to get Mr. Pickney in, and then we'll just open up the questions following that. So if you would, talk with each other about where you went to be served and how that experience went, and anything that came out of that process that was negative or positive for you. Now, all of us have this in common. We are still here, which means that early detection really saves lives. That's one of the benefits of having this Zoom experience, because we see each other and we know that folk are dying all the time. I oftentimes will reference what's going on in this country. There are about 3.1 million prostate cancer survivors in the United States as of last year, 3.1 million. Most of those survivors are white men. And we need to be sensitive to that. They're white men, because far too many Black men were diagnosed too late to be successfully treated. And I want you to just to think about that. There is 3.1 million survivors. Most of them are white men. So let me encourage that you chat among yourselves, and I'm going to try something else to see if we can get Mr. Pickney in.
I have a question for Larry. Larry, did you have proton therapy? You said you had radiation treatment. Was it proton?
No. What I opted to do was I had just a basic surgery. I forgot what they got a name for it, but I just had the basic surgery, and I went around here locally, and my urologist at that time was kind of flaky. So I decided, I said, well, let me check out something else. So Charlie was saying that he had told me, said, well, you know, you could go to Johns Hopkins and get it done if you want to. So you know what? He put something in my mind. So after I left the office from my urologist, I went and called John Hopkins. And John Hopkins told me, said, Mr. Peckham's, they said that we'll do anything that you want us to do. We could do the regular surgery. We could do proton surgery. We could do the radiation. We could do anything that you want us to do. You just make up your mind what you want us to do, and we'll do it. And when he said that, I said, well, the best thing for me to do is try to get this cancer out of my body. So I went up to Johns Hopkins, and I got him to do just surgery on me, and I did the basic one, and got it removed from my body, and like you said, I had no other problems for about 3 years, and then something snuck up on me. So, but then I got that resolved too. So now I'm PSA 0001 or something. Zeros. Mine is untraceable. That's every time I do my PSA, and they said, "Well, Mr. Peckham," she said, "Your PSA is untraceable." So it's first when I started, it was like 6.7, something like that. Then it dropped down to 3 point so and so. But now it's like 0, 0, 1, 2, something like that. So it's untraceable, and I'm grateful for that. Well, did I answer your question, sir?
Yes, you did. Thank you so much.
You're welcome.
Everett, I have a question for you or any of the other men. I was trying to make Charlie a liar by saying I was going to be quiet, but I have to ask this. When you talk with your family members, how did they react to getting tested? Because working with many women, they're struggling with getting their husbands to go get tested. And of course, everybody resists the rectal exam. Hopefully, Dr. Schellheimer is going to tell us they've made improvements in that. But how did you get your families to accept getting the test, the DRE?
Well, it was really quite easy. My two brothers were the first one I talked to about prostate cancer, because after I had tested positive, I told them it was coming their way. I said,
Okay.
Daddy had it, Alan had it, and it's coming your way. So they started tracking their PSA levels, and when their numbers started going up, they immediately went to see a urologist. So both of them were already on board. And then when they had the biopsy and they were positive, they both had their prostate removed. That was the treatment that they settled on. So that went real easy, because I guess I kind of convinced them that there's no getting around it. It was the fact that Daddy had it, and then I had it, and I was positive for it. It didn't seem like it was going to be there's no way for them to get around it, and they just needed to stay on top of it. I told them it's important that you know what's going on with your PSA levels, because that's going to indicate when you need to start taking action. And they did that, and it went well for both of them. As far as my son and my nephews, for right now, they're just monitoring PSA levels. Luckily, they all go see their doctors at least every 6 months or a year, and none of them are showing any indications of any concern right now.
Okay, that's great. That is the biggest deterrent for many men. And as a woman, we chuckle because we have so many exams that it seems like it's nothing, but for the men, it's a big deal. And these myths that we create, it's just like with the vaccine. Everybody has some story that happened, which is made up most of the time. So I think that's good. And if we could get people to keep thinking about saving your life, and this is like a second procedure almost, that shouldn't be an issue, but it is. But thanks.
Oh, yeah. Oh, not a problem. Because if people don't get exams, if they don't go and see their primary care physician for just a general checkup. I say every 6 months. Some people say every year. But I just feel like so many people don't even see their doctor once a year, and they have medical coverage, and they still don't see their doctors. I think that's a big issue right now. Even with before COVID, people saying, "I feel good. I don't have any problems, so why should I go see my doctor?" And I tell people, you could be dying and be feeling good. So the two don't mean anything if you don't have the medical examination and blood work and testing behind it to say that you're doing good. Feeling good is not always doing good.
Exactly right.
Golden, I
Can
wanted
I,
to
you want me to
say
say
that
something? Can I say something?
Okay,
Uh, uh, the backbone to my feeling good and feeling great every day is my wife. She put me on so many doctors things. I got a foot doctor, I got eye doctor, I got hearing doctor, I got this doctor, I got that doctor. If she hadn't put me on a schedule of seeing doctors for different things in my body, I probably would be dead today. But she
wow.
put me on. She said, "Larry, you need to go see the doctor. If I got something wrong with my hand, let's go see the doctor." She don't say, "Well, we'll see if your hand gonna get as big as a balloon." She said, "If your hand is aching, let's go to the doctor now."
That's
She's
great.
she's that type of woman, and I admire her for that. She was beside my side every day that I had prostate cancer. She said, "We're gonna get through this, Larry." She did all the leg work for me. She read books. I read books. So I was well versed in what I wanted to do and when I wanted to do it. And she said, "Well, Larry," she said, "it's time for you to do this," and we did it. And she was right there. So
That's
I
great.
commend all the ladies that's on here listening today, because you need to stand by your man. That's all I have to say.
That's right. Yes. I think Dr. Spencer, did I hear you?
yes, ma'am. I just wanted to tell you that the best DRE I ever had was a female doctor. Uh, I always enjoyed that.
You know, when we have the nurse practitioners doing the DRE, the men don't have an issue.
But yes, trying to get my family members to check their PSA, I don't have a problem because I just give them orders. I still got that military in me, so I just give them orders and they have to report back to me when they had their PSA level checked.
Oh, great, great.
Mr. Baker, I want to raise the question of what specific answers or information are you seeking? Because we have a rich mixture of men who had different paths and they were even treated differently. And I just wonder if you have additional questions that that you want to ask, because I know many of these cases fairly well, but it's best that these men share their experiences so that maybe you can get that personal touch, things that I don't know about them. I will also say Mr. Pickney is having an internet service problem in Williamsburg, and that may be the source of his problem. So they're switching and trying to come in via telephone. In either case, if he does get in, you can hear his story. It's a special story that I wanted everybody to hear. And if he can't get in, we'll do it the next time.
Thank you, Charlie Hill. My biggest thing, of course, was I don't know. Charlie asked me that question about the fear that I had because being diagnosed at 70, 71 with prostate cancer and then realizing that 1 out of every 6 African Americans will come up with prostate cancer. I'm not out of the loop. I, there's not a great fear because I have a strong foundation and a great support system. But it's the unknown. I know that I could probably stick around for 10 years and not do anything with the disease. But and my life expectancy, that's my biggest problem, is that I think that doctors today talk to us from our life expectancy viewpoint. In other words, my life expectancy is about 85 years, and maybe they won't recommend certain things to me because of that life
I think I'm
expectancy.
going outside.
He's out. He's
That's
there.
I think that's Mr. Pickney.
You're on.
Hello,
Hello,
Charlie.
yes, can you hear us?
I think I'm good now.
Okay, so hold up because Dr. Baker is talking right now and you're gonna follow him, but he's responding to a question. And you've come in at the right time because one of the concerns that Mr. Baker and I talked about was his age. And I will tell you, many of the doctors have been fairly considerate in thinking about being too old to bother with. Well, I have a real personal problem with that because I'm older, but I'm not too old. And so we understand Mr. Baker's concern, and Mr. Pickney can speak to that. So Mr. Baker, hold up for 1 second and let Mr. Pickney talk because I think his experiences are rich and it will be helpful for other men. So go ahead, Mr. Pickney.
All right. Good evening, everybody. I'm an 84-year-old Black male, and I've been affiliated with the Hampton Roads Prostate Forum for the last, I guess, maybe 10, 12 years. And at 80, I was diagnosed with prostate cancer. The thought of being old had never occurred. But I asked why now and why me? I had never had any type problems to my knowledge. I never had any symptoms or anything. But it's just by accident that I decided to, at a presentation, I said, well, let me go. I've been talking about this for the last 5 or 6 years now. Let me talk about this myself now. I got the examination and I was just diagnosed with prostate cancer. I had to wait a month or so, but and that was the anxiety part about it. I guess that was the worst part that I experienced was the waiting to see that I would experience any of the symptoms that I had been taught in my exposure at the Prostate Forum and all of our talks and conferences and phone calls. Nothing ever happened. I never experienced anything. I never felt anything. And no one ever told me or said anything about, well, you're old and we will forget about you and you just wait a while. It's not viable for us to be cutting on you at this point. I went along with that and I decided to get proton therapy. And it went well. I had 44 sessions. But the worst part about it is the healing process. It appears that I'm a slow healer. But hey, I'm still healing. I'm here. It's been a wonderful experience of meeting a lot of the folks that I would never have had an opportunity to talk with them. And it's interesting that at 84 now, that how well I feel. Sometimes in the last part of last year, My PCM says, well, Bill, you need to lose some weight. Well, I was at 195. I started in January of 2021. Now I'm down to 163, and I'm got to get a whole new set of clothes.
Wow.
It's feeling good. My wife is happy. I hope. But she stood by me, and I guess she's has learned to smile at me and tell me to get it, shut up, and keep on trucking.
Mhm.
But I'm still standing, open my eyes, and I'm moving slow, but I'm moving.
Thank you.
And that's about all I can say at this point.
Thank you, Bill. What I wanted everybody to hear, and particularly Mr. Baker, this man is 84. And when we started on this journey years ago, folk would say to me, well, look at your age, and you're gonna die from something else before the prostate cancer become a problem. Well, that never set right with me. And it became increasingly clear to me that if you took care of your body, as most of you have, and you eat, and that means eating right and exercising, etc., you could deal with this disease no matter when it came about. The star attraction for this conversation is Golden's daddy. Golden's daddy was diagnosed with prostate cancer at the age of 60 something. He died a couple of years ago at 100, and he died from prostate cancer. So what I would offer up is don't let anybody tell you, or they can tell you, but don't feel obligated to go along with it, that you're getting too old to be treated successfully. Now, a lot of that has to do with how fit you are and how you've taken care of your body. So Mr. Baker, I would say to you, I want you to think about Mr. Pickney as you think about your course of treatment, because he is the second man that I know who has crossed that 80 mark and is doing well from his treatment of prostate cancer. And I think that becomes something that I would want you to share with the other families that we interact with. This family chat is, this is the second one, and the goal is to do this once a month, probably on the last Monday in every month, for as long as all of you decide that it's worth doing. I don't want you to be discouraged about how many people are on the call. Sometimes they're sleepers. You never know they're there, but they're listening. And once they'll get comfortable, they may speak up. So please ask other questions of each other because that's the real value. We all have different experiences. We all can learn still, I believe, from each other. And that's what I'd like for us to do. So I know, Mr. Baker, you didn't finish, but I wanted you to hear from Mr. Pickney, because I knew his story, and I think it may have been helpful to you. So please, Mr. Baker, would you continue?
Okay.
I think I'm finished there.
Okay.
Everything went well. It's just that anxiety, waiting for the second MRI to assess what I might want to do. So I got time. We'll probably do it in June, July next year and figure out exactly what steps we should take from there.
Very good. Very good. I'm going to ask you something, Mr. Baker, so I'll give you a chance. It has something to do with what you've done in your work. So be thinking about it. Mr. Bonner, thank you for being on the call. I just saw you, and I would like for you to share your story I know it, but I would want everybody on the call to know about it if you're willing to do so.
Okay, well, my name is James Bonner. I was diagnosed with prostate cancer about 2009. And I had, that was in September, I believe, August. And I guess I waited until somewhere around November before I had surgery. And surgery went well. I wasn't sure as to, well, I knew what I wanted, but because I would say have the prostate removed, I'm not gonna have any more babies. So, and of course, my primary care physician talked me out of it. He said, get the seeds, because he was saying that the seeds would by me removing the prostate, that would damage some nerves. But after the surgery, I read some more information about it. Of course, that was too late, but even having radiation seeds, that can also damage some nerves. So I lost a little bit of control, but I can control it. But when I have to urinate, I just have to start making tracks. That's all. And so I'm good along with that. But shortly after the surgery, a condition care nurse called me and told me I need to change my diet. She told me a lot of foods I need to stop eating and some foods that I should eat. And basically, it was all processed food. Talking to a relative of mine, he said, sugar, if I'm going to use any type of sugar, make sure that it's raw sugar. But that was my approach there. I just took the nutrition. Of course, I did take some pills, Flomax. I guess I'm still taking that now, but I don't really think I have to, but I just do it out of precaution. But as of right now, I'm feeling great. No problems at all. And the last time I had a digital exam, they said they couldn't feel my prostate. So evidently it's flat. I forgot my numbers, but I am scheduled to see my primary care physician sometime soon, in November. So I will be having a test at that time to see where I am. But then again, with this prostrate form here, I think we're supposed to have something going on somewhere around later this month. So
October the 16th.
Okay, I will be signing up to get it checked at that time to make sure. But that's where I am. I'm feeling great, no problems.
And what about your son? The last time I spoke with him, the two of you were together at a prostate event.
Right. I just talked to him last week, and I told him about this form. Was he aware of it? He said yes, because he's in the fraternity as well. So he can, but he said that in his area, they have done something as well. So he's on top of it. But I remind him to get himself checked, because he's what, 43 now.
Yes.
Yeah.
Okay. Is there anyone?
All right.
Thank you, Mr. Bonner. Is there anyone else on the call who has a question or concern or something special you want to share? I think you can see the game plan, that there are things that you have heard about with real men having had seed implantation, men having had robotic surgery, men having had open surgery. All of these different treatments, therapies are available, but not everyone is right for every man. And that is why it's good to know about them, but even better to talk with a man who has experienced these particular therapies.
Charles, I have something else I'd like to share.
Go ahead, please.
This is Everett. I remember I was just turning 56 when I had my prostate cancer test positive, and I had it removed. And I remember when I went for my first or second follow-up appointment with my urologist after the surgery. And he said, wow, he said, I'm looking at the biopsy from your prostate that was sent to the lab after the surgery. And he gave me an indication that I had a very aggressive cancer, and that it was the prostate tumors were closer to leaving my prostate than he thought they were. And I'm sharing this because I, like I said, prostate not having any warning signs. You know, you don't feel it. You know, no discomfort, anything. So you don't know how aggressive or how non-aggressive your prostate cancer could be. And so I surely know if I hadn't had my prostate removed, that the cancer tumors would have got outside of my prostate, and I would definitely have had some serious health issues then that I probably, you know, that could have been deadly. So I just want to encourage people, being diagnosed with prostate cancer is important, and tracking everything so that you know what's going on, but you have to take action, because I think my doctor could only guess how aggressive he thought it was, and he didn't know for sure till after I had my prostate removed and the lab looked at it and ran the test. And as we all know, prostate cancer tumors, as long as they stay in your prostate, they won't kill anybody. But after those tumors, those cancerous tumors leave your prostate, that's when they become deadly. So time is a factor. I just wanted to share that. Thank you.
Let me build on that, because that's a very valid point. And I had open surgery, as some of you know, that's a male version of a C-section. And this was back in 2002, and there were no robotic or fancy procedures, therapies, whether they were through radiation or through open or surgery. And one of the things that was clear in my case was after the surgery, I too was told that my cancer was more advanced than they thought. In fact, I remembered even today, I was sitting in a meeting with a urologist, and Golden was with me, and he looked up and said that, you know, you would be dead if you hadn't had surgery. And that really resonated with me, because, and it was further reinforced that after 3 years, I had a recurrence. And one of the things that I didn't understand at that time was with the recurrence, I was getting PSA tests, and I said, well, why am I having PSA tests and I don't have a prostate gland? Well, it became real clear that the medical team that worked on me, they were clearly aware of something that I had missed in the course of my preparation. And they said, well, what this means is that you have micrometastatic prostate cancer, or let me say it differently. Your cancer had begun to spread, even though you cut most of it out, it had begun to spread, and that's why it was called micrometastatic cancer. And that led me to about 30 some doses of radiation, photon radiation, regular radiation at the time. And that took care of the cancer. The PSA dropped back down to a consistent 0.03. And that's where I hang around right now, 0.03. But it brought with it some things that I certainly did not want to have. And the one that is most troublesome is, in fact, the incontinence, because the radiation, at least what I've learned, the radiation continues to cook or continues to work. And it looks like I may take my radiation with me to the next life when I make the next change. So please be mindful about understanding words that you don't typically hear, like salvage radiation or metastatic prostate metastasis. These are words that are not oftentimes talked about in the normal case of conversation. So we want to be clear about that. I'm going to ask the question, is Dr. Rod Flynn on the call? Dr. Rod, are you there? Okay. I had invited a newcomer to this region. He's a cancer surgeon, and he wanted to connect with this group to meet many of you. And we welcome him to come, and an additional prostate cancer urological surgeon. I did talk with him, and he indicated that he couldn't join us tonight, but he will be joining us in future. So it's important that we stay abreast and be in contact with these new doctors and new physician assistants and new nurse practitioners, because they're bringing some level of skill to the table that we generally have not had in the past. And frankly, we need their talent. So we have about 8 minutes on the clock, and I'm gonna back off now and see if there are other open issues or questions that we need to attend to before we wrap up.
Hey, Charlie, good evening. This is Joe Dillard. I got on late. I thought it was at 7 o'clock. Then I thought it was found out it was at 6, but
I'm so glad. I am so glad to see you, man, and hear from you. I don't know. I even got the FBI to try to find you for me.
but you know, Ann, she always sends me the link and everything, and I forgot again tonight. But I just like to, share my little story. Of course, I got diagnosed in 2016, and I was 56.
Yeah.
And I had a PSA score of 4.2.
Yeah.
And what I guess basically what I'm saying, I had to do research. My wife was always with me. So we talked to the urologist, we talked to the radiation doctor, we talked to the Hampton Proton. And then we also talked to Dr. Mark Fleming, which he don't treat you unless it gets outside the prostate. So basically we were trying to decide which treatment was better for me. And I ended up going with Proton because from what I was getting, the pros and cons as far as the likelihood of it reoccurring, it wasn't that much different percentage wise. So I ended up doing Hampton Proton, but the insurance companies fight that Hampton Proton for some reason. They said it's not a proven method or whatever. But like I said, I just saw my urologist 2 weeks ago, and my PSA number is down to 0.26. And like I said, it was a 4.2 in 2016, which is still 4.2 is not high, because I have a friend right now where his is a 9. But he said his doctor never really discussed his PSA, and he's 63 years old. So the problem is, like we were talking, a lot of brothers, for some reason, they don't do the research. But fortunately, I hang out with a lot of older guys that deal with this hunting club stuff. They do hunting, and a lot of those guys always, man, you need to watch your prostate to keep up on your PSA. Because I was in a blind myself. But with knowledge, with people talking about it, it kind of helped me. And I want to say it kind of saved me, because I wasn't really on top of that. And for some reason, the brothers, they think it's bad for the doctor to go do that digital record exam, and I tell them, like, hey, it only takes a second. And I ask some of the guys, I said, what, you scared you're going to like it or something? If it's going to save your life, you go ahead and do what you do, So I just keep it real with them on that. But a lot of guys, because I had one guy when I was in there, I'm like, man, what's your PSA? And, he told me, he said, oh man, I had that colonoscopy about a year ago. So he didn't know what I was talking about.
Thank you.
So, but I try to talk about it sometimes. My brother and tell me, man, you don't need to bring that up all the time. But every time I'm around a group of men, at least 4 or 5, I ask them, what's your PSA number?
I am so glad to hear you say that, Brother Dillard, because I know there's a friend of yours who said to me after we put your picture in our newsletter, he said, you know what, I did not know he had been through that. And look, he looks great. And maybe I need to do more and do a better job with my own case. I'll let you figure that out in future. But I will also say that your daughter and your wife were fantastic in ensuring that you got the attention that you, oh, hello, that you got the attention that you needed.
Yeah,
Yeah, and I just wanted to pop in too to say that thank you for the work that you do, because when my husband was diagnosed, I immediately thought of you because of the work that you had done and the community word that you had got out about prostate cancer. So I knew that you were going to be one of my first resources. And when I did talk to you, you put my mind so much at ease and just gave me resources. And, you know, I just went to work from there to find out everything I could find out, and using a lot of the, you know, the contacts and resources that you did. So what you do in the community is definitely very, very helpful, and you never know when you're going to need it. So I'm glad that you had the word out, so I knew who to come to. So thank you.
Thank you. To God be the glory.
thank you.
Yes.
Mr. Baker, do you have any more questions, since you're the man who is really the star on the stage, and we wanted you to get as much information as needed for your decision-making coming up?
Not right now. I'll probably have more questions in subsequent months as we keep talking about prostate cancer.
Very good. Does anyone else have any thoughts, concerns, issues that we need to bring to the table? We have about 2 minutes. We have the ability to go beyond the 1 hour. But however, it doesn't feel at this point that it's necessary. But I want you to certainly remember that each time we do this, and we hope to do it once a month, you're going to hear something new and different, because new and different men, along with some of the others, will be on the call. The idea is that we have this as an opportunity for men and the women in their lives and other influences in their lives to come together and just have a conversation, because we have to do better. We, that is Black men, have to do better with this whole prostate cancer issue. And I believe we can do better. And what that really means is that more Black men will live longer, more families will not have the problems associated with a sick man in the house or a dead man eventually. So that's why we need to do it. And I will say also, if there's one thing that we can leave for the young men who come after us, who look like us, we can leave clear answers. We can leave ways in which to go about addressing these real concerns. Prostate cancer is not going to go away in the short term. I am pleased to tell you that at a future call, we're going to have a gentleman who is a biomarker researcher, and he is working on some biomarkers that will provide information about prostate cancer, aggressive prostate cancer, without some of the current approaches. So I want you to meet him, and I think he'll be delighted to come on. And I will offer this: if you come to our or participate in our panel discussion on the 11th, then you'll get a chance to hear him, because he is one of the speakers, and he will be discussing his research to date as it relates to prostate